Welcome to the Hank Cisco Show, ladies and gentlemen. Don't touch that remote. Let me tell you, doctors don't make home visits anymore. So we're coming into your home. And I think in all my shows, in the 26 years I've been doing this, I think I've had every doctor that you could think of, but I didn't have the doctor that I'm going to interview today. It's had to do with stroke, and so I'm trying to keep all my audience healthy, from the heart, the kidneys, hips, and where, so we got, everybody's moving along. Now, my guest came here to Northtown High School this morning, and I don't know how many hours, 10 hours ago, she was in California. So tell me first your name and what you do and your title at Einstein Hospital. Okay, got it.
Good morning. I'm Dr. Rabia Choudry, and I'm a neurologist at Einstein. I'm the division head of the neurology division, which is part of the internal medicine department. And I see patients with stroke and seizures and multiple sclerosis and a lot of other things.
Right, and stroke. There's another word for stroke?
Yes, cerebrovascular accident is the technical term for stroke.
That's another word. Sometimes we're working right?
Correct.
Okay.
A stroke is sort of like a heart attack of the brain.
Yeah. That I'm a former police officer, and it's an old saying, they say, get a young doctor and an old lawyer. You never go wrong, right? So I got a young doctor here. And so tell me something about yourself, okay? You're nice looking, right? And you're a doctor. And why do you want to become a doctor?
So
What dropped the seed?
There are three of us in my family, my brother, sister, and I, and we all went to medical school. And I think
What did they do?
My brother is a vascular surgeon. His name is also Dr. Choudry, and he works.
What's his name?
Dr. Choudry.
All right, I want you on my show. Okay, go ahead.
He's a vascular surgeon.
Okay, that's good veins and all.
Correct. And my sister works as a physician assistant in Kentucky.
In Kentucky. Well, I'm sorry. What's her name?
Syra.
Syra, when you come up here, we'll visit, okay? Now, tell me the stroke. Is there a warning or anything I should be aware of that I might get a stroke? Is there anything that I start getting the feeling that something's not working right?
There are several signs of stroke. They could be as simple as the corner of your mouth drooping.
Go like this?
Sure. Oh. Or not being able to see out of one eye, not being able to feel on one side of the body, and in more severe instances, not being able to move one side of the body.
Oh, in other words, so almost like you're paralyzed,
yes.
Right? And so what kind of treatment? What do you do if somebody's comes by ambulance or whatever? I want to tell you that something just came to my mind. I was with the Northtown Police. I used to drive the emergency wagon, and I used to take him into the receiving ward. And we took this fellow. He got shot. He had a bullet in his head, but he was still alive. And he was laying there. And this doctor, I remember he was from Sweden, the country, very distinguished guy, So I was on duty, and I'm watching, So he he pinched over here, nothing moved. Then he pinched over here. So it was, and then I looked and I says, doctor, I says, he has a bullet over here, and then his hip paralyzed. I says, is he going to live or die? What a goofy question. And you know what he said? He says, who am I to say whether he's going to live or die? Mm-hmm. And it's true. So somebody up there gives the order, right? Mm-hmm. So that's one way you find out if they have a paralyzed or so.
That's right. If someone is unable to tell you how they're feeling, that's one of the things that we do is we may apply some sort of a stimulus to see if they respond. So pinching is frequently what we do.
Yeah. So, all right, what else now? Well, what else can you tell me about your job?
So noticing the signs of stroke, I think, are very important. So all of the things that we just talked about in terms of the symptoms, and noticing them early is extremely important. because if you get to the hospital within a few hours of having had the symptoms, we can frequently give a medication that's like a clot buster. And if we give the clot buster, we can frequently...
What do you mean by that? What's that?
It's a medication that's given through an IV.
Oh, okay.
And it frequently a stroke is caused by a clot in one of the blood vessels that feeds the brain. And when we give this clot buster, it goes to that site and it actually breaks up the clot. So that's one helpful way of alleviating the symptoms of a stroke. But we can only use that if you come to the hospital within a certain amount of time.
Oh, you know, I had to go back when I was driving the emergency wagon. This man had a stroke and whatever, you know, heart attack, and turned blue like, and took him into the receiving ward, and the doctors, and I never forget. Now I keep on remember where all these here doctors, where they're from. It was from Argentina, you know, and so he's there, they put him on the floor, and he was turning like blue, and they put a thing here, and shock, what do you call it, electric shock or something?
Defibrillator.
Yeah, it goes boom, and his whole body bounced like that, you know. So that's how they stimulate, right? You do that?
No, that's more if there's if the heart is not acting appropriately, but we don't have anything similar for the brain.
Oh, it's separate.
Yes.
Right. Okay. All right. Now, your brother. Why did you? How come you didn't do the both? Why didn't you both study the same thing? That way you could do your homework together.
Well, it's funny. In fact, we do have a lot of patients in common because we do a lot of the same things. So we were going over some of the things that could cause stroke. I think I was starting to mention when you have a blocked vessel, say your carotid artery is blocked, that can also lead to a stroke. And one of the things that my brother does is he actually does surgery on that.
Tell me about that. I see the doctor always touch over. Is that a main? Tell me something about that.
That is a main artery. There are 4 main arteries that go up to the brain. The carotids on either sides, and
one on each side.
And then the vertebral arteries in the back of the brain.
Oh, go ahead.
And so he can actually do surgery on the carotids if they're involved in causing a stroke.
Yeah. What's the main treatment for a stroke?
Well, it very much depends on when along the time course of a stroke the patient comes into the hospital. So if it's been 3 days since you've had your stroke, there are things that we can't do anymore. So we'll usually treat with aspirin or some sort of a blood thinner, depending on where we think the stroke came from. Yeah. But if, like I was saying earlier, one of the things that we want to really project to the community and really educate about is getting to the hospital very quickly after having your stroke symptoms, because that's when we can really intervene. And that's a big thing that we're doing at Einstein. We actually just within probably the last 8 months or so received our primary stroke certification, which means now if you call 911 and you say, my wife is having symptoms of a stroke, the ambulance driver can actually bring the patient to our hospital.
Whoa. Run up by, ladies and gentlemen, this is very important. I've had the ambulance come for my wife. She has Alzheimer's, and every once in a while she passes out, and we had to call the ambulance, you know, and or 911. And I think that's important. What you said is tell them so they'll be prepared coming there, right? Tell me about that.
So there are certain hospitals that have the expertise in treating stroke. And now Einstein in Montgomery is one of those hospitals.
Well, I can say Montgomery Hospital didn't do heart operations, and now they do them because I know, because Dr. Anderson operated on me and got a little bit of a cut over here, 95% blockage, and I'm bobbing and weaving. So go ahead.
So the ambulance drivers actually have instructions now that they can bring the patients to our hospital.
Right. Go ahead.
Which again, if patients come to the hospital quickly enough, there are things that we can do. Eventually, what we're going to be able to do is actually treat strokes in other ways that are now FDA approved. Right. One of them being we can actually take what's called a catheter and go through the femoral artery, which is in the groin, feed it up to the brain. I know this is a lot to visualize, but feed it up to the brain and give that same clot buster directly to the clot. And sometimes we do that when it's been too many hours since the stroke occurred. Or we can take a device that actually pulls the clot out by the same mechanism, going up through the groin and pulling it out.
You had some tools, but you didn't have time to bring them because you came right from the airport here, right?
Yeah, we had a little bit of a flight issue yesterday, so coming back from California.
Now I got a question from the audience. He says, if you had a stroke, are you more likely to have more?
Sure, that does put you at higher risk of having strokes. And so one of the things that we do as providers is to make sure you understand what the risk factors are of stroke. So diabetes, high blood pressure, high cholesterol,
You
smoking.
got everything I got here. Go ahead.
Smoking?
Huh?
Smoking?
Oh, no, I don't
Okay,
smoke.
well, there you
I
go.
don't do that much drinking either, so.
All right. But those are 4 things that we really like to work on with our patients to make
Why
sure.
do people smoke, you know? That don't even make sense. I smoke, but I'd never inhale. And I don't want to sound like President Clinton, but that's what happened. I was working on a job, construction, and I put the jackhammer down, and I was just resting. And the guy come over and he says, come on, get that thing working. I was down in Atlanta, Georgia at that time. And I says, well, them guys are standing over there. I says, they're not work. He says, yeah, but they're smoking. So the next day I get a pack of cigarettes and then I put the jackhammer down, smoke, and not inhale. But, so I never learned, not learned, but I never inhaled. But that's no good, right? Tell people about that.
So smoking, essentially it hardens your blood vessels, it increases your blood pressure, and it leads to things like heart attack and stroke. So it's one of the things that if someone's had a stroke, or even if they haven't had a stroke, we as doctors, we usually have a long conversation with our patients to try to get them to stop smoking.
Yeah, well, what else? All right, now smoking's, what else?
Diabetes, so it's very
Diabetes. Now,
important.
you have to control that.
Absolutely.
Right, and what else?
Blood pressure.
Blood pressure, well, control that too.
Exactly.
There's pills for that. In other words, do what you're supposed to do, right? Right, take care of yourself.
Right.
Right, all right. Now, and then we did mention something about some of the signs. Over here moves and you start losing the feeling, and what should I do? Just call right away.
The best thing to do is call 911.
And mention just what
Exactly what your symptoms are.
Yeah.
The other thing that we like to teach people is something called a FAST exam, F-A-S-T.
What's that?
The F stands for face, so if you notice any face drooping. The A stands for arm, so what we tell patients to do, or their family members to tell them to do, is to put their arms up. And if one of the arms starts to drop, then we know that it's weak.
Wait, the one with drop
Is the weak side.
You're losing control.
Exactly.
And this one's still got strength.
Right. So you might notice that the face is drooping on the same side as the arm that's dropping.
Like this.
Correct.
You better call 911, right?
And the 2 other pieces of that are, the S stands for speech. So if the speech sounds slurred.
Slur?
Correct. And the T is basically for time, because time is very essential in treating a stroke. So if you notice signs and symptoms, then it's essential that you call 911.
Right. Right, now, let's say you and I are talking here, and suddenly I notice something changing. I'll notice something that maybe you're not aware of.
Sometimes, yes.
That happens, right? So then that's when someone should go on the offense, right? Make some calls, do something, right?
Sure. We hear frequently about patients who were talking to a family member on the telephone, and all of a sudden their speech became slurred. And luckily that family member was on the phone, was able to call 911. So we hear that a lot.
All right. Now, you treated. Let's go over that treatment a little bit more. So people, a lot of people are afraid. And I had Dr. Alexandra, and she's a heart surgeon.
Yes.
And she was talking about, and you just touched on it, about the different ways that they've gone into the body without cutting you open, like meat with the the heart operation, I don't belong to the zipper club over here. I just got a little cut over here. So, and she's mentioned, and along with Dr. Anderson, like you just mentioned about you get enter this way or that way or, without cutting you all up.
Right.
Tell me that.
So basically it's a catheter, which I guess in layman's terms is like a straw, which is inserted in a blood vessel that's in the groin area. And then inside of that catheter are other pieces, other instruments. And it gets fed all the way up to the brain. And what we can do by doing that is actually look at the circulation in the brain in much more definition, and we can see where the clot is. So sometimes it's just a matter of delivering the clot buster to that area. But sometimes if that's not a reasonable approach for that time, they can take a device and actually pull the clot out.
Again, oh my God.
Depends
Right,
on the
right.
situation. Depends on the situation.
I got another question from the audience. We got a live audience over there that really, they're interested in what you have to say. What are the long-term treatments on a therapy for a stroke victim?
So as we mentioned a little earlier, a lot of it has to do with thinning the blood. So aspirin might be the best treatment for some patients, whereas Plavix and other blood thinner might be the treatment for other patients. In another subset of patients, they have strokes because their heart is in an abnormal rhythm, such as atrial fibrillation. And in those patients, we have to use a stronger blood thinner, like Coumadin, or some of the newer ones, dabigatran, or there are some other newer agents that we can use.
Right. I got one here. What's that say?
What are the consequences of stroke? So
And that audience out there, right up the one in the last row up there, the question came from the top row. Go ahead.
So it really depends on what part of the brain was affected. So for some people it may be their speech, for some people it may be their strength, for others it may be their ability to walk or talk, to remember. So it's very dependent on where the stroke affected the patient. But that brings me back to the original piece is try to get to us early so we can treat your symptoms as soon
The
as
early
possible.
bird catches the worm.
There you
right?
go.
Okay, here's another one. Another from the audience.
What should a patient look for in a neurologist? That's a good question. I guess someone who knows what they're doing and has experience. Those of us at Einstein, we've all been working for quite some time. I'm in my 10th year of practice. And in terms of stroke, you would want to go to a center that has expertise in treating stroke. And earlier I mentioned that we have primary stroke certification. And I think we were certified in August.
Certification. All right, that's the next question. What did Einstein need to do to get the certification?
Well, we had to show.
Because you had to get certified to get the heart too?
Yes.
Tell me about that.
Well,
Now, we got to understand, we got a hospital right closer. You don't have to go to Hong Kong, Yokohama, or you don't have to go to Europe. You got it right here. Right?
right.
Go ahead.
So what we have to do is demonstrate that we know how to treat patients with stroke. And it's not just from the doctors, it's from the nurses to the technicians who are doing the MRIs and the CAT scans. And so what we did was we collected a lot of data to show the committees that we were capable of treating stroke. Not just capable, but we did an outstanding job with treating stroke.
Well, yeah, well then you have to be tested or so to be certified.
Right.
And then, school, right?
Well,
You say you went to school with your brothers and sister?
Actually, no, we didn't go to school together, but we all kind of did the same thing.
Right, okay. But you didn't go to the same school?
No.
No? Okay.
But I think
Tell me about your mom.
my mom is a homemaker. She also lives in Montgomery County.
She lives where?
In Montgomery County in North Wales.
What, she just taking it easy, retired or so?
She's a homemaker. She's retired, yeah.
What's her favorite food?
She loves Pakistani food, so.
What?
Any kind of Pakistani food. She's a great cook
How about you?
herself.
What's your favorite food?
At the moment, probably sushi.
Yeah? I don't know. Give me spaghetti and meatballs. Well, you go up to Collegeville Bakery for good Italian food. If you want to go up there, tell your staff there.
Ah, sounds
you know.
good.
So what's in the future? What's a future now for your job? What's out there that's the latest thing, the newest thing?
Well, I think our
that's on the front burner.
Our focus right now is on stroke and treating stroke the way that I think heart attacks have been treated for the last 20 years. Neurology has kind of caught up. And because cardiologists have been using clot busters for the heart for many years.
What do they call it?
It's called TPA, tissue plasminogen activase, which actually breaks down clots.
Oh.
But cardiologists have been using it for years, whereas neurologists really started using it probably in the late 90s.
I guess when I interview your brother, he's going to tell me more about that, the clogs and how do you break up the log jam, whatever they call it. I guess, I don't know. And
it's sort of plumbing to an extent because you really are breaking up these clots.
Rotor-rooter.
Right.
So you've been at Einstein Hospital since the beginning, right?
At Einstein Montgomery, yes, since the doors opened.
And but you never with Montgomery
No,
Hospital.
I wasn't with
They're
Montgomery.
knocking that down. I don't know if you
saw,
ever seen.
yeah.
Oh, so sad. I used to drive the emergency wagon. Used to go into the receiving ward, and when in the police officer, I never was in a morgue. The only morgues I ever saw was in the movies. But that was something. A lot of experience. With what a doctor has to go through, and people don't realize. That what a sacrifice you do to get that education, and then to be helping people. I think I don't know. I get sentimental now. so all right. Tell me a little bit more about you.
I was telling you earlier how I was born in South Carolina,
Right.
and then my parents moved to New York. And
What part of New York?
Staten Island.
Staten Island. I was born in Brooklyn.
Actually, we were in Brooklyn first for a short period of time, and then moved to Staten Island. Yeah. And so we pretty much grew up there, and then both my brother and I went to medical school. My sister went to medical school overseas, and then we somehow ended up here.
Right. Well, I'll tell you, I think Einstein is moving along, always getting something new. They're adding new. I think they got some of the top doctors in the country. So, and so tell me a little bit more about this stroke bit. What is some of the things that people should know about prevention? That's everything at prevention.
So that goes back to treating all the risk factors of stroke and making sure your sugars are under control, your blood pressure and your cholesterol, not smoking. Those are all essential. Making sure you take your medications like you're supposed to, and monitor your diet. All of those things are important.
Why did you do what you're doing with strokes? Why didn't you become a dentist or something?
Well, I think when I was going through figuring out what I wanted to do.
What encouraged you to do that?
I guess it wasn't only stroke. It was the whole of neurology that I was interested in, because it's very much a puzzle. You have to figure out what part of the brain or what part of the nervous system the problem is coming from, and that's how you treat it.
Oh, okay. All right. What portion of the here? What's this one? Another one from the audience.
What portion of your practice is about stroke? A large percentage of my practice is about stroke, actually, because we treat so many at Einstein Montgomery.
What is it when that's slow?
We treat so many strokes at Einstein Montgomery that it becomes a large part of my practice.
You think that is something, a lot coming on now, or what?
I don't think it's any different than it is at any other hospital or any other state, but I think that as we watch the population age and we see a lot of the
people living longer, like me, 91, right?
I hope that you never have a stroke.
Well, I hope not.
But having all these risk factors for stroke, blood pressure, cholesterol, things like that, and then the patients that have the abnormal heart rhythms, so we do see a fair amount. I would say when I do a week in the hospital, I can easily see 3 to 7 strokes in just that week.
In 1 week? Oh my God, I didn't know that. I know I had Dr. Grace here. She had to do with cancer, and she was at Montgomery Hospital. And she 20 years. She went from school right to Montgomery Hospital, and she said there was more people in southeastern part of Pennsylvania that have cancer than any place in the United States.
Is that right? Wow.
I can't believe it. So I says, well, geez, then I had cancer, prostate, and colon. So I'm still bobbing and weaving. But I was wondering why did so many people have cancer in this area? Now we find out in Ambler they had a big asbestos plant. Then over in Valley Forge had a big thing. And then Montgomery Hospital, or knocking Montgomery Hospital down, they didn't start knocking it down until they spent a week or two moving asbestos out of there.
Oh, wow.
So I'm saying to myself, if you have cancer and you went to Montgomery Hospital, and the next thing you know, you're being treated in a place that has asbestos. So I don't know if that was one of the causes of why there's so many people in the southeastern part of Pennsylvania that have cancer. So what do you think?
I'm sure it played a part.
With all them asbestos places around here, has
Sure.
played a part.
Yeah, there are a lot of environmental factors involved in causing cancer, and
Yeah.
so I'm sure that's
But
part of it.
so tell me the future now. What are you going to do? What are you going to do?
Well, just at Einstein, we are trying to expand our practice quite a bit. We hired 2 new people in the last couple of months.
Oh yeah.
And we are
Working in your department.
working in our department. So yeah, one of our doctors, Dr. Tyler, he's in the hospital seeing strokes as well. And then one of our doctors who's been with us since the beginning, Dr. Bradley, he also sees strokes.
What kind of tools or toys, whatever you want to call them, that you use for the stroke?
Well, we listen to everybody's heart, so we definitely use a stethoscope to make sure they don't have any murmurs or any abnormal sounds coming from these major vessels, the carotid arteries.
What I like to do, maybe sometime, I'll check with the director. We'll do a show at the hospital and show how you're treating them. So our half hour is over,
Oh, wow.
and California, here we come. So, ladies and gentlemen, thanks a lot, and for allowing us to come into your home and have a doctor's visit. And so I really appreciate the fact that you went through so much to be here this morning. You know, get the red eye. What do they call it? The red eye?
Mm-hmm.
Yeah, from California. So, doctor, thank you so much.
Thank you for having me.
Ladies and gentlemen, thank you for allowing us to come into your home and keep. I guess they say keep the faith, keep bobbing and weaving, and keep a song in your heart. Who's it? Lawrence Welk says that. You know, so. And then, so until we meet again, adios, amigos. Gracias.